There just isn't enough staff. There isn't enough nursing staff. There isn't enough EMS.
Emergency department closures in rural and northern Manitoba continue to worsen, with residents in the Interlake-Eastern area now feeling the effects. Ongoing staffing shortages is making access to basic health care difficult for Manitobans, with residents in Toulon at times being forced to travel between 30 to 45 minutes for a doctor.
Our nearest hospital would be Stonewall, but it isn't always open. They would then divert to Selkirk, which is usually open. And I'm not sure after that where they would go.
Toulon Mayor Anna Pazdirsky says for a town of over 1,200 to not have a doctor available to the community is frustrating.
This is kind of what the future is going to look like. Our emergency has actually been suspended since 2016. For rural communities, it's a huge issue.
About 60 kilometers north in Arborg, Manitoba, the situation isn't much better. Between July 16th and August 15th, residents there only have access to an emergency department doctor for 7 days. The nearest health facility is in Gimli, about a 30-minute drive.
That's certainly a concern that that's the nearest medical facility.
Arborg Mayor Peter Duick says they are taking matters into their own hands. The community is hosting a family from Ukraine where both the husband and wife are doctors. He says he is hoping they can become the town doctors going forward.
It's not an overnight solution, but our community is excited about being able to offer a safe community to this doctor family, and we're hoping that it will become a long-term relationship.
There are 68 ERs in rural and northern Manitoba. As of last week, only 26 are open 24/7, 20 are fully closed, and the remaining 22 have frequent closures or reduced operating hours. Doctors Manitoba President Dr. Candice Bradshaw says there are more ERs closed this summer than ever before. Quote, "This truly is a provincial issue because more closed ERs in rural areas can result in backup in Winnipeg, where ERs already have record wait times."
It's certainly getting more difficult to imagine yourself as a rural or northern Manitoban.
MAHCP President Bob Moreau says allied health professionals in rural and northern Manitoba are completely stretched thin.
When we start piling more and more patient loads into smaller and smaller facilities down the road, whichever one happens to be open, I mean, it really doesn't take a math major to figure out, well, that's going to have a significant impact on the ability of that facility who is open to handle that increased load.
Pazdirsky says it's important for people not to forget about rural Manitoba.
Highly trained EMS is important. Available ambulances are important. And people need health care.
In Winnipeg, Alex Karpa, City News.